Good afternoon and welcome to HPFY's monthly webinar on all things respiratory. My name is Laura Castricone. I'm a respiratory therapist. Just as a reminder, we are recording this for future use. If you want to see it, you can watch it on our YouTube channel. And at the end of the presentation, we'll open it up to questions and answers. Also, we'd like to invite you to let us know if there's any respiratory subjects you'd like us to speak on at these webinars. You can email me at laura@hpfy.com. So let's talk about what we decided we'd present to you today, which is seasonal allergies and the associated respiratory issues that may arise from having seasonal allergies, since we are just beginning our spring, if it ever gets here. So let's first start at the beginning. So what is an allergy? And a lot of people have allergies, we know that, but what exactly is going on in your body when you do have an allergy? So the way people respond to allergies is the body's way of attacking a foreign invader. Allergies can be anything from dust and pollens, foods, medication, pet dander, environmental things. We even have, I have a daughter that's allergic to nickel. So even if she wears any jewelry that has nickel in it, she breaks out in a rash. So there's all types of allergies. They can manifest themselves in multiple different ways. But today, we're going to mostly talk about seasonal allergies that attack the nasal and respiratory system. So when you have an allergy and you have an offender, the body tends to interpret these offenders as a foreign substance. And like any other foreign substance that enters your body, it begins to attack it. And it does this by releasing some chemicals into your body that cause your nose to swell or run, you to get a scratchy throat, and all different types of things. It's actually an abnormal reaction of the immune system. And mostly today, we're going to talk about pollen allergies, because that's what we see mostly in the springtime and summer. So here are the most common reactions to pollen. Rhinitis, which is also called a runny nose, as the pollens get into the nasal cavity. The body's way to attack it is to release histamine, and a lot of times the nose will swell or start to run. It also can cause wheezing, because as we get a stuffy nose, we get extra mucus in there. It can also cause the caliber of the airway to narrow, which can cause the wheezing. Or you can have an allergy to the offendant that actually causes you to have an increase in your asthma symptoms if you have asthma. Coughing. Coughing is a very important mechanism in our body. It's our way of ridding our body of foreign substances, especially anything that enters our airway. So even though it may be annoying to cough, it's your body's way of trying to get that foreign invader out of your airway. If the coughing persists and you can't get it under control, or if the coughing is so bad it causes you to have vomiting or things like that, that's when you should get your physician involved and get a proper cough syrup. Sometimes using things over the counter is not the best thing, and we'll talk about that in a minute. Congestion, it could be nasal congestion, it could be chest congestion. It's because as your body is responding to this foreign invader, it's releasing chemicals that are causing inflammation and causing the tissues in your nasal airway and in your actual airway to swell. So that's why you get all this congestion. Watery and itchy eyes, same thing. So these pollens are getting into your eyes, they're getting into your nose, and they're causing it to be inflamed, and that makes your eyes itchy. And then, of course, we have some people whose allergies get so bad they actually have difficulty breathing or shortness of breath. If they have underlying asthma or another type of respiratory disease, it can really make it worse. It actually exacerbates some of their symptoms. So if you have asthma or any of those types of problems during this time of year, you're probably using your inhaler more or using some medications that your doctor may have put you on. Next slide. So what happens to your body during allergic reaction? So what happens is the foreign substance enters your body, usually through the nose. So you're breathing in, and these microscopic pollen particles, and you'll see my next blurb there, it says the allergens such as pollens, they have tiny spikes on them. We can't see them. But as soon as they enter the nasal cavity and they get stuck in that mucus membrane that we have there, they start to irritate it. And our body's natural way to stop irritation is to release chemicals and to try to get rid of it. So with those allergies, our body starts to overreact. It starts to release histamine, and histamine can make your eyes swell, your nose run, your throat itch, all those types of things. It starts a chain reaction of all these things in your body to attempt itself to get rid of that foreign invader, those pollen particles out of your body. Allergies can be acute or chronic. So what that means is you may only have them when there's pollens in the air, like this time of year, I just noticed this morning on the news, they said that the tree pollens were low, but the grass pollens were high. And very soon we're going to see the tree pollens high. That's when you see all that green film on your car, your windshield. That's all the tree pollens that are just being dispersed all over the place, and you're breathing those in. So most people have acute allergies. They only get them during certain periods, or if they're come in contact with certain substances, anything that offends them. And some people have chronic allergies that the allergy never subsides. They're allergic to something in their environment. It could be a pet. It could be something in their home. It could be fabrics. It could be a lot of different things. And that could be a chronic problem. And the problem with your allergies, not only is it uncomfortable, but it can also lead to sinusitis, which is the official name for a sinus infection. No one likes to have a nasal sinus infection. It's very painful and annoying. But what happens is when you have an allergy, a lot of times that mucus that accumulates as it's trying to rid yourself of that form, it doesn't move. It stays inside that sinus cavity, and it gets thick enough that you can't blow it out or cough it out. And sometimes you'll just start to have a virus or bacteria start to grow in there, and then you get that nasal infection. So what should you do if you have a pollen allergy? I lived with a man for 35 years that had a very, very bad pollen allergy, and I learned a lot from him because he grew up that way. So these are things that I learned from him, as well as I know from being a therapist. Keeping your window shut during the day on high pollen count days. It may be gorgeous outside and the wind is blowing, but if you're an allergy sufferer, that's a bad day for you because all those pollens are blowing all over the place. They're getting into your eyes, they're getting into your nose. If you have your windows open, they're getting inside your home, they're settling on your sofa in your bedroom, on the counters, and you're touching those surfaces and putting them back onto your body. So if it's appropriate, put on your air conditioner so that way you can filter out the air and you don't have the windows open with the pollens entering in your home. If you've been outdoors all day, and we do encourage you to go out if you feel well enough, obviously go out and enjoy this type of weather, but try to take, my husband would do this all the time. He'd take a shower as soon as he got home, and I'd say to him, why? And he'd say, I get that pollen off of me. And it's true. You have to wash the pollen off of your face, your hair, your body. It's sticking to you. It's on your clothing. So if you have high pollen allergies, the first thing you should do if you've been outside doing some gardening or maybe taking a hike is get home, take off those clothes that you're wearing, and try to take a shower to get the pollens off your body. Another big thing in high pollen seasons is to change your linens very often. Remember, your face is on that pillowcase all night long and in those sheets all night long. And if there's pollens trapped in there or any other offenders, you're going to have a miserable night. So changing your linens often is a good idea, and also washing them in hot water to kill any kind of pollens that might still be clinging to them or any kind of bacteria. We all used to like to do this, hang our laundry outside. I still like to do that. But in high pollen count days, obviously when the wind is blowing and the laundry's outside, the pollen's sticking to your laundry. And when you bring it inside, you've now brought the pollen indoors. And if you're allergic, it can settle anywhere in the house as well as in the clothes you just washed. So you want to be judicious about that. It's probably just best to use your dryer or dry them inside on high pollen count days. It is recommended that if you do have very bad allergies, pollens, dust, mold, that type of thing, that you get an air filter or an air purifier for your house, because it's going to make the air that you breathe cleaner. So those have filters in them, and they should be cleaned often and checked often. So that way you're not recycling some dirty air. We're getting used to wearing masks. I never thought we'd all get used to that, but we have. So it's not a bad thing to actually put on a mask when you go outdoors to do activities. If you're going to be sweeping or maybe doing some gardening or whatever you're doing outside, if the pollens are bothering you, try a mask. Try a fabric one. If that doesn't work, try an N95 mask, because we know the particulate matter can't pass through there. And like I said, you won't look like an outcast because everybody's wearing a mask so often lately that this is pretty common. You can certainly try over-the-counter medications. I would say be very careful with this. Over-the-counter medications that are used for allergies a lot of times can mess with the medications you're already taking, or can cause some havoc on some systems that may not be working well for you. In other words, if you have high blood pressure, it can exacerbate your high blood pressure. A lot of these over-the-counter preparations they're made for the general public, but if you have specific needs, you probably should talk to your doc. He or she may be able to prescribe something specifically for you. So before you go reaching for Claritin or anything else, which are great products, you should still check with your physician. Consider purchasing a humidifier or a dehumidifier. So in your home, if your house is very damp, you're going to get more molds, and you're going to have more problems with allergies. And consequently, if your house is too dry too, a lot of times it bothers your nose and your throat. So having a humidifier, if you don't have enough moisture, or a dehumidifier, if you have too much moisture, can be a real big benefit for your home and the ambient air in your home, the air that you breathe most frequently. And also, like I said, consider purchasing an air purifier. It'll get rid of it'll get rid of ozone. It gets rid of pollens. They cling to the inside of the air purifier that can be cleaned. But these are great tools for people that have high allergy issues and have problems being comfortable, especially during this time of year. So we talked about the over-the-counter options for relief. So here's what pretty much you have in your toolbox if you want to go over the counter. So you can go any store you want and buy antihistamines, and just what it says, antihistamine. It stops the histamine release through your body. Decongestants are just what they decongest. They get rid of that congestion that comes along with allergies, whether it be nasal or chest congestion. It could be either a pill or a nasal spray, but they help you to keep breathing. Just a word of advice. I've had a lot of patients that I treat for different things, and they like to use nasal sprays like Afrin and over-the-counter things like that. If you have a problem with nasal congestion and you're using an over-the-counter nasal spray, be very, very careful, because it has a reverse effect when you overuse it. Continual use of a product like Afrin will cause your nose to actually swell inside, and it gets to the point where you can't breathe through it at all. And I've seen this happen with multiple customers that I've had. So be very careful with nasal sprays and check with your physician before you start using them. These are newer things, neti pot. Neti pot's been around for a while, and the nasal lavage systems. Basically what you're going to do, because you have a nasal cavity that joins both sides of your nose, you can actually pour water in one side and have it come out the other. And that's basically what the neti pot does. It's cleaning out the sinuses. However, the neti pot you also have to be very careful with as well. I would suggest using distilled or sterile water. Never use water from the tap, and never use water that's been sitting around. Remember, there are a lot of things that can happen to you by having something foreign go into your nasal cavities really close to your brain. We've had some people get some strange things, fungus and things like that. So be careful with the neti pot. Make sure you understand how to use it. And they also sell the actual nasal lavage packets that you could buy that are specifically prepared for this. And then they have combination medications that have both an antihistamine and a nasal decongestant in one. And as I said before, as a rule of thumb, we always tell people before embarking on any of these drug regimens that you would buy over the counter, always check with your physician. Because if you have certain disease states or certain problems, or you're taking certain medications, these may interfere or cause something else to go on. So, and these are some of the contraindications to using the over-the-counter preparations: high blood pressure or heart disease. And you'll notice that there are some cough syrups that say HBP on them, high blood pressure. These are ones that are designed for people that have high blood pressure, so that way it doesn't disturb their heart rhythms with the medication they're currently on. Some of the other ones can also increase your eye pressure or exacerbate glaucoma. They can cause an enlarged prostate. They can aggravate bladder issues or cause bladder disease. They can exacerbate breathing problems. Even though they're supposed to help them, they might make them worse. And you have to be careful if you have thyroid disease. A lot of these medications are contraindicated. As I said, it's very important to get your doctor's approval before you start taking these things. Just because they're on a shelf in a store doesn't mean that they're appropriate for everyone. Always be very judicious before you take any over-the-counter preparations, even though they're available. If you're really suffering with your allergies and you don't want to go the over-the-counter route, call your physician and see if they could prescribe you something, or if he or she has a recommendation for an over-the-counter preparation for you to use based on their knowledge of your conditions. So another thing that's newer now is immunotherapy. So some people will go the drug route, some people will take allergy shots, and this is what this is. This is immunotherapy, and it's given by injection. And what they do is they give you a little dose of what offends you. So if you're allergic to tree pollens, they're going to give you a little bit of tree pollen, a little bit more tree pollen, until you develop a defense for the offender. It builds tolerance. If administered properly, it's up to 90% effective. So you really have to know the allergist you're going to knows how to do immunotherapy and does it well. You can't expect immediate turnaround. It's not like when you take a Benadryl and all of a sudden your symptoms seem to subside. This can take up to a year to feel the full results of it. So you have to be patient. And taking shots can last anywhere to 3 to 5 years in order to stop or reduce the attacks. So if you're really struggling with your allergies and you have to get it under control because it's really interfering with your activities of daily living or your lifestyle, then you really should talk about immunotherapy with your physician. So currently there's no cure for your allergies, only treatment. They don't know how to cure them. We don't have any cure for them. We can treat them though. And the only thing with immunotherapy is it's costly and it's not always covered by insurance. So you'd have to check with your insurance to make sure they're going to cover these injections, whether it be weekly, monthly, however often your physician's going to do it, and whatever preparation they're going to use. You have to make sure it's going to be covered because it could be very expensive, especially if you're doing it for a full few years. So we kind of covered what goes on in the spring and early summer. And actually in the fall as well, because we get our ragweed here in the Northeast in the fall. So if you're a real sufferer for allergies, call your physician, try some of these remedies that we said, put your air conditioning on high pollen days, and hopefully you'll be able to enjoy the beautiful weather that's coming. Do we have any questions in the queue? No questions? Well, again, as always, thank you for being here. Thank you for attending. And for future, if you have any suggestions for future topics that you'd like to hear, certainly email me at laura@hpfy.com. Otherwise, enjoy your summer, and we'll see you next month. Thanks.